Well, I think if you talk to any of us who are public health folks, we're pretty much aware that this virus is easily transmitted, and that in the absence of therapeutic medicines, in the absence of a vaccination that would afford a lot of us some immunity, and in the absence of the kind of testing that you could do every day at your home with a 5-minute test result, we are left in the near future looking at the kinds of strategies that help us protect each other. And that is the physical distancing, that is infection control, and it is what we call containment, making sure that we identify people who are positive as quickly as possible so that they can isolate and their close contacts can in fact then quarantine. That is what we all will need to do until we have either all three of the possibilities that I mentioned are in play, or one or two of them would actually make it more likely that we can look towards different ways to protect ourselves. But we have to protect ourselves. I mean, this virus is relentless, and we still have more people dying of COVID-19 every single day in LA County than they die of any other single disease. But thanks, and I'll take the next question.
Our next question comes from David Rosenfeld with LA Daily News. Please go ahead.
Thank you very much for taking my question. I wanted to ask you, looking at the numbers in general, they seem to just be staying level. So with this relaxation, what do you expect to see in those numbers? And, it sort of begs the question I think we're hearing from a lot of people now is like, if these numbers have been the same, why did we need to go into 2 months of lockdown when we come out, we're essentially facing the same problem?
I think that's actually an excellent question, and we do ask ourselves the same question. If nothing's really changed, what did we accomplish? Well, we did accomplish something huge. We never had a surge. We never had a peak. And I can promise you, if everybody hadn't done their part, if people hadn't stayed home, that would not have been what the last 2 months looked like. We would have had many, many more cases and many, many more deaths. The good news about reopening slowly is we do get to take our time, and we're not going back to the same conditions we had before we closed. So as I've noted, when we reopen any place that's reopening, it's using really strong and stringent infection control measures, and there's introducing a fair amount of distancing, and we're all going to be wearing our face coverings when we're near each other. And that, again, is our hope for being able to reopen slowly, and again, not see the surge in either cases or deaths that would result in overwhelming our healthcare systems and causing many more families a lot of grieving. But thank you for that question. I'll take the next question. Hi.
Could you please describe what the public health impact is that's related to the lockdown, not directly related to COVID, but things related to the lockdown like suicide, substance abuse, depression, other things related to it? What is that picture looking like right now? And as we move into this slow journey that you mentioned, how are you, as the public health official, weighing these impacts with the impacts directly related to COVID, deaths and lives lost and illness and so on?
Yeah, that's a great question. We are, of course, tracking deaths that are happening from other causes. I will note that at the moment, again, there's a slight lag here, but at the moment we neither have seen an increase in the rate of suicides in LA County nor in the rate of overdoses. That doesn't mean that we don't have serious issues related to depression and anxiety. So, I want to note that those aren't the only two measures to let you know whether or not there are people who are really suffering. I would say when we look at our survey data and we see that between 40 and 50% of residents who are being surveyed by national survey firms and some of the local survey firms, and they're all saying they're extraordinarily stressed and they're depressed and they're anxious. And so I do think this has come, this pandemic has come at a great cost to sort of the overall health, and we have to attend to that as well. You know, in part, you see this, you know, there's a lot of fear, even as we reopen. You know, I have a fair number of people who say to me, you know, oh, don't reopen because I don't want to be made to go to work because I don't think it's going to be safe for me to go to work. And I also get folks who say, even when you reopen, I'm not going to go out and do these things. I have a chronic condition and I don't think it's really safe for me. But they feel fearful as well. So there's the economic toll, I think there's the emotional toll on our well-being, and then there's the physical toll as well. And, you know, as public health folks, we have to look at the whole picture. But I want to say when you're in the middle of a pandemic, you also need to make sure, for all of us, for all of the reasons you just mentioned, that our healthcare system does not get overwhelmed and that we don't have what we call excess deaths that are happening at this point in time.